5 on your mental health tonight. As many as 25 million people in the U.S. are anxious about flying. And yesterday's midair collision in D.C. is creating even more concern. It can be triggering for people. Here to answer and talk about this is Dr. Cristina Montalvo, a psychiatrist at Tufts Medical Center. Always love to see you, doctor. I'm sorry it's under these circumstances. Plane crashes are rare, and you have to tell yourself that. But the fear of flying is not. A lot of people have it. I have it. What causes it?
So the fear of flying, like you mentioned, also known as aerophobia, is an anxiety disorder, and nothing really causes it. There's things that can make it worse, and we know that folks who have fears of losing control when they're in a plane, or in small locations, also known as kind of claustrophobia, or even having childhood experiences or learned behaviors from your family, could bring this on later in life.
Oh, I'm really glad you said that. I was on a plane with my sister. We were little girls, and we were going with our grandfather to go anyway across the country, and the engine failed, and the pilot came over, and you don't forget that. You don't forget that. And then, you know, in this business, you see these stories over and over again, so it can be like that. And I know a lot of people who have this fear of flying. Can you treat it on your own? Is there a way you can get past it? Is it a mental game? What is it? What do you do?
So there is no reason to treat this on your own. There is clear treatment that we can do that includes therapy, medication, or a combination of both. And there are specialists who treat anxiety disorders, but even those who focus specifically on this. And it ranges from helping you deal with really what can be a life-altering condition that can affect your quality of life. And we see people improve anywhere from 2 to 3 years, even shorter times, depending on who you're working with.
That's encouraging. In the meantime, do you think that people with aerophobia, and I'm sure there are levels of it, right? I still get on a plane. People still get on planes. Some people won't because of that. It stops them. Should they avoid consuming information about this crash, or is knowledge power here?
As much as we all enjoyed seeing you on the media, I do think that being exposed to this constant coverage sometimes can make people believe it is occurring more often than it actually is. But in reality, car crashes are killers of people much more than aircraft kind of catastrophes like this. So what I would recommend is, if people with this type of condition are feeling more triggered, are feeling more fear or panic, that I'd recommend kind of being mindful of that, what they're watching, and to reach out to their healthcare providers.
No, it's great advice. And am I correct saying that there are, I'm not a doctor, I don't even pretend to be one, but that there are different levels of that fear, correct? But they're all legitimate. If you feel it, you feel it.
Absolutely. And I think that any catastrophic event like what has happened can affect anyone and can induce symptoms of fear, which is a normal human symptom that any of us can have.
That's for sure. Dr. Montalvo, thank you so much for your time and your expertise. We always appreciate you. Thank you, doctor. Stay well.
Yep.